Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Joanna Moth. Joanna is a registered nurse at Washington Hospital Healthcare System.
So thank you for joining me today as we learn how to manage diabetes while maintaining an active and healthy lifestyle. So my name again is Joanna. I am currently a registered nurse at Washington Hospital, and I'm very pleased to be here with you guys. And thank you again for spending the evening with me. So let's go ahead and get started by, the end of this session. Our goals for today is that we'll be able to state the specific effects of physical activity and how it affects your blood glucose levels. We'll also be able to describe the difference between aerobic and anaerobic exercises, list 3 ways to incorporate activity in your day-to-day life, and also 3 recommended safety practices for diabetics during exercise. Start with the overall benefits for diabetics with being active. And these don't only apply to diabetics, it's the general population as well, but we will target on some specific diabetic-friendly information. So this little colorful slide here on our left, I just want to touch briefly on what happens on a cellular level when we exercise. Our cells take in and use that glucose, that sugar in our body more efficiently. And this in turn will increase our metabolism. And when you have increased metabolism, your body is working a little bit more and burning more fuel throughout the day faster and eliminating toxins and all of that faster from the body. This then supports and sustains weight loss. Now, keep in mind, in order to have a dramatic loss in weight and sustaining weight loss, you do need to kind of have a balance between being active physically and eating the right diet. Another key factor with exercise and benefits is it strengthens your heart and circulatory system. Now, this is really important for our diabetic population because, as we all know, diabetic patients tend to have other comorbidities. Some have heart failure, some have peripheral neuropathy or renal nephropathy issues, all related to diabetes. There was actually a research done that showed women who exercised or were active for about 4 hours a week actually lowered the risk for developing heart disease by 40%. That's a pretty big number if you think about it. And the data was adjusted to remove any confounding factors such as the starting weight or BMI of the women in the study, whether or not they were smokers, and other risk factors for heart disease. So when it boils down to it, being active is really good for your heart. Additionally, when we exercise, the cells that help to take up our glucose are more responsive to the insulin that our body produces naturally. So it counters that insulin resistance that so many of us have with diabetes type 2. Additionally, you will be able to decrease your fat cells, like we mentioned, and increase muscle tone. So you'll be stronger. And of course, when we exercise releases endorphins and makes us feel better. Overall improvement in fitness, relief of stress and tension in the body. So all good things, right? The main takeaway too is that we will be able to, with consistent activity, lower your blood glucose levels and improve our A1C. Our hemoglobin A1C is a lab draw, a test that basically shows kind of on average the last 3 months how our blood sugars have been doing, and it comes out as a percentage. If we are in the 5.7 and below range, then this number is indicative that we are at a low risk for diabetes. When you fall anywhere between 5.7 to 6.4, that puts us in the pre-diabetic range. And that's very important because we can significantly lower our blood glucose and improve A1Cs with activity. So we can reverse that. Even more so when you are considered diabetic, which is an A1C level of 6.4 or above 6.4. So when you are above 6.4 and are considered diabetic, this is where being active is super important. So keep in mind, when you exercise and be active consistently and lower those glucose levels and hemoglobin A1C consistently, you can revert your diabetes because diabetes type 2 is a preventable and reversible disease. So it takes a lot of work, but it's definitely worth it. All right. And again, the one thing too is we don't want to be focused too much on weight loss because that will happen eventually. But even if we increase our activity on a day-to-day basis, exercise can improve your A1C, even if you don't see actual weight loss. So this is all important. There are two general types of exercise. I'll start over with aerobic exercise. With aerobic exercise, it mainly focuses on the heart. So cardiovascular conditioning and using oxygen to help and circulate through the body to burn fuel from fat cells. Because it uses the energy derived from the fat cells, it lets us exercise for longer periods of time, as opposed to using glucose, which will limit the amount of time that we can sustain that particular type of exercise. So some examples for aerobic exercise is walking, dancing, and biking. Fairly simple things that we can incorporate into our day-to-day activity. On the opposite side, we have anaerobic exercise, which is focused more on a muscular conditioning that uses stored glucose that's already in our muscles in the body. Basically, what this means is it's any activity performed at an intensity that doesn't allow sufficient oxygen delivery to your muscles. So you want to think of vigorous activity that you can't really sustain for long periods of time. Some of these examples are weightlifting, push-ups, sprinting really fast. And kind of in our minds, when we think about sprinting, we attribute it to running, which is a cardiovascular activity. But sprinting is actually considered to be anaerobic because you go all out from 0 to 100 and 100% effort, but you can't sustain that for a long period of time. You can only sprint for so long. And that's why it's considered anaerobic. You're using your muscles as opposed to breathing throughout at an easy, even pace. So one thing to mention about anaerobic exercise is that it can rise your blood sugar levels, but it's only temporary. The increase in blood sugar is due to the actual stress of pushing your body hard, and it doesn't last long. Typically, as your body comes back down from the exercise and kind of restores itself, your blood sugar tends to go back to normal within an hour after. I'll talk a little bit more about anaerobic exercise because it can sound a little overwhelming if you're not kind of used to it. So going forward, when we add anaerobic exercise, the goal is to have 2 to 3 resistance training sessions a week. It doesn't have to be anything crazy. Basically, what the resistance training means is you want to use your muscles to contract against some sort of resistance, either to your own body weight or some type of prop, like exercise bands, exercise machines, kettlebells, or weights, anything like that. What we consider as a healthy and optimal choice for anaerobic exercise is what's called HIIT training, or high intensity interval training. It sounds a little overwhelming, I guess, but it's quite simple of a process. High intensity interval training, what we do is we alternate longer periods of physical activity done at a moderate intensity with short bursts of vigorous exercise. That's often, less than a minute. And a very easy example of this would be something that you might want to entertain is you walk or jog, whatever is comfortable for you, at a comfortable pace for 3 to 5 minutes. And then for 30 seconds to a minute, you move as fast as you can. And then you stop again and repeat the intervals. So rotating between walking and speed walking might be something that would be possible for the more elderly population, or even just moving at a quicker pace from walking and then just moving as fast as you can. The more you do these intervals, the more your body starts to adapt to that specific exercise, and it becomes easier over time. The good thing that comes out of anaerobic exercise is that it actually improves your fitness level faster than just doing a moderate intensity for a longer time. So, for example, if you are on a bike and you're just going at the same speed, same rate for like 30 minutes on your bike, you actually get more effective or efficient exercise out of doing intervals, riding your bike for 3 minutes and then really pedaling hard and fast for 30 seconds and then back down. Just rotating. So you kind of get more bang for your buck, if that makes any sense. You can exercise for a shorter amount of time with the same effective results as if you were to just coast in one consistent leveled intensity. So when we choose an exercise program, why not both? Both aerobic and anaerobic exercise are equally beneficial in providing a decrease in hemoglobin A1C levels, insulin sensitivity, and blood sugar overall. Combining both of these exercises are actually more beneficial than just doing one alone. The next slide here is, generally speaking, safety considerations regarding diabetes and exercise. These are general concepts, and I'll touch more in detail as we go further. So clearance from your physician. This includes type of exercise, level of exercise, or duration as well. Wearing proper clothing. This is actually really important, especially your shoes and socks. Basically, you have a higher risk of getting diabetic neuropathy because over time, the increased blood sugar levels deteriorate your nerve endings because of the poor blood supply. And most of the time, you lose feeling in your feet. So for this reason, we want to make sure that we have well-fitting shoes, closed-toed shoes, especially when we're exercising, to prevent any rubbing, blisters, or punctures from happening when we exercise. And as we know, you're higher risk for infection as well, because bacteria tends to like sweet things. So that puts us at a disadvantage. Other safety considerations are to prevent low blood sugar when we exercise. Try and partner up with someone, at least at the start when you're starting a new exercise regimen, just to provide a sense of safety and mutual motivation. Also, you want to try and schedule the day and time of the activity to be consistent. We want to think about wearing a medical identification bracelet of some sort or a medical alert device. And of course, we want to stay hydrated. We want to talk to our doctor about how and when to exercise, because depending on other comorbidities or illnesses that we might have, we might need further exams or tests to be cleared before attempting a certain exercise that you need to do. In addition, we want to cover our medications and make sure that we are in the safest possible place regarding medication and exercise. A lot of the times, our doctor can suggest changing up dosages. For example, increase activity or exercise, especially if you plan to exercise about 2 to 3 hours after your meal. You may need to change up your dosing for pre-meal insulin, for example. And that way you can prevent a drop in your blood sugar when you exercise. So these are the kind of factors that are important to think about when talking to your doctor. We can plan out the best times for your physical activity with your doctor. More than likely, your doctor will ask you to have a diary or a log of your blood sugars. That way, we can see or monitor the trends when you're most likely to be high versus low. And then we can kind of adjust the best time for you to increase physical activity. Once we get those information cleared from our doctor, we definitely want to plan it out. Choose the type of exercise that you like, something that fits kind of easy into your daily schedule. And there's plenty of them that we can go on to talk about along the way. Before we exercise, preparation is key. And again, this is why it's so important to know what medications you're on. Now, if you don't take any medication for your diabetes, or your diabetes is not labile in terms of your blood sugars, you may not need a thorough investigation of meds and whatnot for your physician, but it's always best to err on the safe side. So listed here are some general guidelines for pre-exercise blood sugar levels. We want to check our blood sugar about 30 minutes before exercise starts. This is important because if you find that your blood sugar is less than 100, your blood sugar might be too low to safely exercise or partake in increased activity. If it is low, we recommend that you eat a small snack of about 15 to 30 grams of carbs. Anything like a small fruit, a little bit of juice, crackers, or even glucose tablets that many sports stores like Dick's Sporting Goods, Big Five, or REI, they carry glucose tablets that you can kind of chew on to boost your blood sugar. If you test at 100 to 250, you're likely good to go. And if you test higher than 250, you want to take caution. Typically, you want to correct the increased blood sugar before starting your exercise. If possible, you can check your ketones in your urine. There's little test strips that you can get at Walgreens or CVS that test for ketone levels in your blood or urine. When you have an increase of ketones, that means that your body doesn't have enough insulin to take down and control your blood sugar. This is important because we can put ourselves in a state of ketoacidosis, which is a complication of diabetes that causes the body to become acidotic or basically have too much acid. And it is considered a medical emergency at that point. And if you are taking insulin, the risk of developing hypoglycemia after exercising can be highest actually 6 hours to 12 hours after you exercise. So that's something definitely you want to keep in mind. Remember how I mentioned that hydration is very important for our diabetic population. This is because when we become dehydrated, our blood sugar levels actually increase. So we want to avoid major spikes and major lows in our blood sugar. So when we plan out what to bring on our little exercise or what to drink, this is kind of the basic information, whether you want to opt for sports drinks or plain water. Now, for most of us, especially if we're just, generally not trying to do a marathon or do anything too intense, water is perfectly sufficient, especially when we take into consideration what is in most sport drinks today. When we're doing any vigorous exercise, we do lose a lot of electrolytes. So a lot of our sports drinks contain electrolytes like potassium, magnesium, calcium. We tend to lose those when we sweat. So it's a nice replacement if we plan on doing anything intense or for a long period of time where you're really vigorously sweating. It's important to have these electrolytes in your body because they help your nerves and muscles function at an optimal level. And in addition, it can help rebuild muscle tissue after you exercise. We have carbohydrates in our sports drinks. So there's a lot of sugar. So we definitely want to make sure that we're reading our labels when we're purchasing anything really for the amount of carbohydrates. Typically, we'll see about 6% to 10% of our drinks having carbohydrates in them. So, for example, Gatorade and Powerade, I believe, have about 25 grams in each 12-ounce bottle. So that's not too bad. It's about a little over 6%. I would be cautious of anything higher than that 6 to 10% range. Caffeine can be also listed in some of our sports drinks. This is where we want to take a little bit of caution as well, mainly because caffeine gives you that extra burst of energy by releasing glucose in the body. So it can actually spike your blood sugars quite significantly. We'll watch out for that. Sugar-free sports drinks. There's a lot of sugar-free or zero labeled drinks out there that have sucralose and aspartame. They're all artificial sweeteners. And you can take them, but at a moderate amount. We tend to not recommend consuming too much artificial sweeteners because at this point in time, there's still not enough research on the effects of the artificial sweeteners over time. So we don't know longevity wise if there's any negative effects. So it's better to do everything in moderation. So again, when we're trying to decide sports drinks versus water, if we're not doing anything intense like marathons or soccer games or anything like that, for the average exerciser, water is enough. And how much water, that is one that we would defer to our doctors for, mainly because there's certain comorbidities or other medical issues that we are dealing with. For example, if we have congestive heart failure or renal failure, we want to avoid drinking too much fluid. So that's just something to keep in mind. In general, a recommendation is to drink about 8 ounces of water about 30 minutes before exercising, just to make sure that you don't get dehydrated during your exercise. Additionally, if you tend to run on the low side for your blood sugar, researchers have found that slow and steady consumption of carbs from sipping on a sports drink can actually help to prevent low blood sugar during any type of aerobic exercise. So that might be something that you want to think about if you do tend to run low. During your exercise, you want to watch out for symptoms of low blood sugar. For longer workouts, you want to check out your blood sugar every 30 minutes or so, especially when you're trying a new activity. You want to be cautious until we know how our blood sugar responds in certain changing exercise habits. For sure, we want to stop exercising if your blood sugar is 70 or lower. Also, if you feel symptomatic and you're shaky, you're weak, sweating, or have any type of confusion, you want to stop immediately and check your blood sugar. When you find that you are hypoglycemic or your blood sugar is 70 or below, you want to follow the 15 every 15 rule. This rule is basically you want to take 15 grams of carbohydrates every 15 minutes until your blood sugar is at least 70 or above. And it sounds a little daunting, but if you think about it, 15 grams of carbs. I have a little table here to the side with a list of fast-acting carbohydrates. If you have them on hand, it's kind of odd, little candies here and there, but it is recommended to carry with you some hard candy or jelly beans. If you look over there, it does note that Jelly Belly, jelly beans. If you have 15 pieces, that corresponds to 15 carbs. On the other hand, you can also take 4 ounces of some type of fruit juice or soda, regular soda, not the diet or zero branded soda. And of course, we will only continue your workout once your blood sugar returns to a safe range. After exercise, no surprise, we want to check your blood sugar again. Exercise does draw on our reserve sugar that's stored in our body. And as our body rebuilds the stores of sugar, it'll take the extra sugar from your blood. And that's what lends to hypoglycemia. After you exercise, having a snack of lower acting carbohydrates like granola bars, trail mix, adding something with protein in there after the workout can help to prevent the drop in blood sugar. And basically, what this information means is when you have diabetes, testing your blood sugar before, during, and after exercise can actually be just as important as your exercise itself. So, getting started. I know we listed a bunch of information for us here. And when trying something new, sometimes the most difficult part is actually starting. If planning out the exercise is daunting, take a deep breath and know that you're far more capable than what your mind lends you to think. Um, Going forward, the standards of medical care in diabetes recommends 150 minutes of moderately intense exercise a week. 150. I know it sounds like a lot. But going forward, in order to start something, it's always good to know where you currently are, right? And that way you'll be able to make out a game plan for achieving whatever goals you have in mind. So I gather from our little conversation earlier, we are more likely to be under the classification of sedentary, which is perfectly fine. I myself am probably sedentary or low active. I definitely need to do better. And this is why we're all here, is to do better at being active and leading a healthier lifestyle. So these are daily step counts to the right-hand side here. If you have a smartphone, a lot of smartphones are equipped already with a step counter. So you may want to take a look at what type of phone you have and if you have a step counter. Otherwise, you can buy step counters pretty much anywhere, CVS, Walgreens, online, they're everywhere. And that just helps you kind of give you a little snapshot of where you are. So activity-wise, there's unstructured activity and structured. Unstructured activity is basically what you do on a day-to-day basis, and structured activity is an actually planned exercise. When we want to promote activity, we want our sedentary time. So we want to avoid prolonged sitting by increasing the number of breaks that we take. It's kind of funny when you think about taking a break from sitting, but this is very important. Looking here at this activity pyramid here, the top level is the smallest point. That this is where we want to cut down. And at the base of the pyramid, the widest part, this is where we want to focus a lot of our time and effort. So on the top of the pyramid, we want to cut down on sitting, watching TV, or generally sitting and working at your desk or your computer, what have you. So if we are generally inactive, we want to increase our daily activities that you see at the base of the pyramid. So every day we want to try to walk outside, do some yard work, park your car further away. Little choices throughout the day that really help to promote being active. So taking the stairs instead of the elevator. And I know this might be hard if we have limitations, especially in our joints. Sometimes it might be easier when we're starting to go down a set of stairs as opposed to going up. And that's perfectly fine as well. If we're sporadic about our exercise and activity, we want to focus more on the middle of that pyramid. There's goals set there 3 times a week. We want to stretch and strengthen our muscles. Use some weightlifting, tension bands, yoga or Tai Chi. A lot of the time there's some free yoga or Tai Chi at some of our senior centers. I know it's been a big change with COVID. We'd have to just take a look into that. Reaching that goal, 150 minutes a week. So again, reframe our mindset. 150 seems like a huge number, but we definitely want to aim for reframing our mindset. We can change it up to 50 minutes of exercise 3 times a week, 30 minutes of exercise 5 times a week, or 25 6 times a week. So little breaks here and there. And of course, if we don't have that much energy or time to pull out that chunk, we can shorten those sessions. You know, if you don't have that amount of time, 10 minutes of exercise 3 times a day will give you the same benefit as a 30-minute workout at one time. The most important thing when you're starting to exercise or incorporate anything as a new regimen is to have fun. You want to track your progress, make some goals. Don't shoot for the stars 100 miles away. Start slow and steady goals. And that way, you'll be able to really maintain exercise and activity as a part of day-to-day living. We do want to recap that, or not recap, but I do want to mention that we want to try to go no more than 2 days between our exercise sessions or periods of activity. Because when we go longer than 2 days, the amount of glucose in our body or the stores, it tends to lag, and it'll take a little bit longer to re-up the body's metabolism. So we want to kind of keep it in a constant motion to maximize our benefits. That being said, the last little thing I wanted to cover today is the importance of balance training. Now, for our geriatric population, this is going to be very important. Balance training involves doing exercises that strengthen your muscles that help to keep you upright and functioning. This includes your legs, your core muscles, your back. These types of exercise can improve stability and help to prevent falls, which is very important and unfortunately prevalent in our more geriatric population. It's interesting to note that balance is super critical for our elderly population. As we age, we typically lose a lot of muscle mass, and as a result, we lose strength. We want to start working on having a strong core on a day-to-day basis if possible. And actually, we start to lose a sense of awareness of where we are starting at the age of 30, which is pretty interesting to me. So starting at 30, we start to already lose, a sense of where we are in space and lose muscle mass. So it's important to, while we can, keep up that strength. This last little section here is a little exercise called a one-legged stand. And this is a balance training. It's fairly simple and easy to do, and you can definitely modify it to fit what your needs are. Beginners can do this with one hand, like on a chair, a wall, or a counter to help with your balance. But generally speaking, we want to try this 3 to 5 sets at a time. You'll stand with feet hip width apart and shift your weight so that your belly button is over one side. So if you can start on your left or your right, whichever one, and then you'll gently lift the other opposite leg and hold. And you'll find, I actually tried this last night when I was preparing for this Zoom, and my balance was totally off on my right side, a lot better on my left. So what they say about it starting in their 30s is probably pretty true. So this is just a quick, easy exercise that you can do, and it'll help with burning calories and strengthening your core. So very easy to do. But that pretty much concludes our session. Thank you guys for joining in, and I really appreciate your input and participation. You guys have a very good night.